Today we're going to be talking about the treatment of epilepsy. Epilepsy is a condition characterised by greater than 2 recurrent unprovoked seizures. So it affects 0.5 to 1% of the population, and the current drugs are effective in around 70% of cases, so we can't really assume that the drug that we're going to give is going to work. But certain drugs have been targeted based on the epilepsy syndrome. So today we're going to focus on 3 different types of seizures: absence, tonic-clonic, and partial. So partial seizures are ones that begin locally and they remain localised. So the symptoms will depend on the region of the brain that's involved, and patients don't become unconscious, unlike the generalised seizures, although consciousness is altered. So the temporal lobe epilepsy is most common. In generalised seizures, the whole brain is involved and you will get a loss of consciousness. Tonic-clonic is a strong contraction of the musculature, so you get the rigid extensor spasm as well as involuntary vocalization. And then the absence seizures, also known as petit mal, because it's very common in younger children, and the children generally stop the action that they're involved in, and they'll just stare vacantly for a few seconds with no motor disturbance. There are 4 potential drug targets that we can use. So the first one is GABA, and GABA is an inhibitory neuron or receptor. So if we target this, we're going to get an increase in inhibition. So the neurons that are firing readily are going to be inhibited, and this can be through a direct inhibition or sort of stopping the reuptake of GABA. Our second target is sodium channels, and this is these are use dependent. So neurons that are firing at a high frequency are going to be targeted and they're going to be blocked. Our last target for today are the calcium channels, and most specifically these are the T-type, because these provide the pacemaker potential that's within the thalamus, and it's responsible for absence seizures. So if we target this site, we can treat absence seizures. Here we have a GABAergic neuron, and we have the GABA stored in these vesicles here, and so GABA is going to be released into the synapse, and it has the potential to bind to this GABA-A receptor here. And this is what we want, because we want the inhibition of neurons. However, once GABA has sort of finished its job, or it's not all required, it'll be uptaken through these transporters here. And this is a potential target to increase the synaptic concentration of GABA. So one potential target is a drug known as tiagabine, and it's going to bind to this transporter here, and it's going to block the pathway of GABA into the presynaptic neuron. So this is obviously going to increase the synaptic concentration of GABA. Now another potential target is the GABA transaminase, which is this enzyme here, which will work to break down the GABA that has been reuptaken by this transporter here. And so if we were to inhibit GABA transaminase, we would have more free GABA that can enter the vesicle and then be released into the synapse. And the name of this drug that works on GABA transaminase is valproate. Valproate is a first-line tonic-clonic as well as a first-line absence seizure, whereas tiagabine is a second-line treatment for partial seizures. Our second class of drug are sodium channel blockers. So as we're aware, sodium influx into a neuron is responsible for the potentiation of an action potential, as it'll depolarize the cell. So if we block this channel with one of two drugs, either carbamazepine or phenytoin, we're not going to allow the movement of sodium through this voltage gated sodium channel, and so we're not going to get the potentiation of an action potential. These drugs work in a use dependent manner, so neurons that are firing at a high frequency are going to be blocked. The two drugs that we're concerned about are carbamazepine and phenytoin. And so carbamazepine is a first-line drug for partial seizures and a second-line drug for tonic-clonic. We'll preferentially use carbamazepine over phenytoin, but they're both used for partial and tonic-clonic seizures. They both interact with cytochrome P450, and phenytoin has some notable adverse effects that they like to test you on, including gum hyperplasia, acne, and hirsutism. And it's as a result of these adverse effects that we prescribe carbamazepine over phenytoin. The last class of drugs that we're going to talk about is the T-type calcium channel blockers. And so these are going to be in the thalamus. This is my crude representation of the thalamus. And the T-type calcium channels are responsible for the pacemaker potential. So I tend to think of it like the pacemaker potential that we see in the heart, which tends to look a little bit like this. However, the pacemaker potential in the heart is L-type calcium channels, whereas this is T-type calcium channels. The drug that we use is called ethosuximide, and it blocks the calcium channels here. And they're used for absence seizures. And the way that I tend to remember this is that ethosuximide sounds a little bit like Ethan, and Ethan reminds me of someone who would be a little bit absent in class, so he's not really a sort of boy who would pay attention, and so that's how I remember that ethosuximide is used for absence seizures. Absence seizures can also be treated with valproate. As we've discussed earlier, valproate is a GABA transaminase inhibitor. And so I sort of think of it like both Ethan and Valerie are the sort of kids who wouldn't really pay attention in class. Just to recap on the treatment of different types of seizures, so partial seizures, our first line therapy is carbamazepine, which is a sodium channel blocker, followed by tiagabine, which is a GABA transporter or reuptake inhibitor. Sorry, I've got the hiccups. For tonic-clonic, we're going to have valproate, which is a GABA transaminase inhibitor, followed by carbamazepine and phenytoin, our sodium channel blockers. And then for absence seizures, we have ethosuximide, which is a T-type calcium channel blocker, and followed as well as valproate, which is once again a GABA transaminase inhibitor.